Hello everyone, myself Ashwin, lecturer from Faculty of Physiotherapy, Dr.M.G.R. Educational and Research Institute. So today we are going to discuss about the gaits, its components, determinants and the pathological gaits. So what is gait cycle? So gait cycle is defined as the sequence of time interval between the heel strike of the one limb to the subsequent heel strike of the next limb. For example, the heel strike of the right limb to the next heel strike of the same limb, we call it as gait cycle. Here we have two phases of gait cycle. One is the stance phase and another one is swing phase. Stance phase will contribute about 60% of the gait cycle, whereas the swing phase will contribute about 40% of the gait cycle. In stance phase we have heel strike, foot flat, mid stance, heel off and toe off. Okay, so what is heel strike? So this phase usually begins with when the heel touches the ground and start bearing the weight on the particular limb and prepares the opposite limbs to leave the ground. Here both the limbs will be in contact with the ground, so we called it as double limb support or double leg stance. Next phase is foot flat. Okay, here the whole sole of the foot will be in contact with the ground. The next phase is mid stance. Here it begins with the foot flat and ends with the heel off. So here usually one of the leg will start bearing the weight of the whole body, whereas the other leg will be moving directly beneath the body, which we call it as single leg stance or single leg support. Okay, the foot flat and the mid swing will contribute about 40% of the gait cycle, whereas the heel strike will contribute about 10 to 11% of the gait cycle. And the final phase is push off, which means the heel off and toe off. So it usually begins with the heel off and ends with the toe off. So why it is named as push off? Because it will push the weight of the body directly to the contralateral limb and prepares the particular limb for the swing phase. Here we will see the demonstration of the stance phase. Okay, now we are going to see about the heel strike. So here his right heel is striking the ground, whereas the left limb is preparing to leave the ground. So both the limb are in contact with the ground, so we called it as double limb support. Okay, next we are going to see the foot flat. Okay, foot flat, your whole sole of the foot is in contact with the ground. Next is the mid swing. Here in mid swing, his one leg is bearing a whole weight of the body, whereas the other limb is directly beneath the body swinging in the air. So we called it as single limb support. Finally, the push off, which is the heel off and toe off. Okay, it usually begins with the heel off and ends with the toe off. Okay, so now the next limb is preparing to for the swing phase. So now we are going to see about the swing phase. So usually swing phase begins with the heels off and ends with the toe off. Okay, so here the limb will not carry out any weight, freely swinging in the air. Okay, so here we have three phases. One is acceleration, that is initial swing. Next is mid swing, and the deceleration, that is final swing or terminal swing. So acceleration is otherwise known as initial swing. Okay, it usually begins as the foot leaves the ground. The leg will be accelerated forward, leading to knee flexion and dorsiflexion of the same limb. Next is the mid swing. It usually begins after the acceleration. So the accelerated leg will be passing directly beneath the body, leads to flexion and dorsiflexion, shorten the limb and clears the ground prepares for the mid swing. Final phase is the deceleration, that is the terminal swing. It usually begins after the mid swing. Here the legs get slowed down and prepares for the heel strike. So here the moving limb is controlled by the flexors and extensors of the knee joint. Now I am going to demonstrate about the swing phase. So now his left limb is demonstrating the acceleration phase, mid swing and deceleration. So now we are going to see about the basic terminologies of gait. So first one is step length. So step length is the distance between the heel strike of the one limb to the subsequent heel strike of the next limb. Next, stride length. Stride length is the distance between the heel strike of the one limb to the subsequent heel strike of the same limb. Next is your step duration. So step duration is the time taken for the completion of one step, whereas stride duration is the time taken for the completion of heel strike of the one extremity to the heel strike of the next extremity. Next is cadence. Cadence is the number of steps taken by the person in 1 minute. So final is the double limb support. Double limb support is usually seen in the mid heel strike phase, whereas both the limb will be in contact with the ground. And single limb support. Single limb support is usually seen in the mid-stand phase, whereas the one limb will be in contact with the ground. So now we are going to see about the pathological gait. So the first one is Antalgic Gate. From the name itself, it is clear that painful, which is something related to pain. So here what it happens, like when there is any injury, trauma or inflammation of the pelvic, hip, knee or ankle joint, the patient will adopt this gait. Okay, usually what it happens, to prevent bearing the weight on the affected limb, the patient will reduce his stance phase and increase his swing phase, so that to reduce the tension over the affected limb. What it happens, like here in the affected limb, you can see reduced stance phase due to because during the stance phase the whole weight of the body is beared at that particular limb. So the stance phase is reduced, but the swing phase is increased, because during the swing phase no amount of weight is carried at the particular limb. In the contralateral limb, the swing phase is reduced. So now we will demonstrate the Antalgic Gate. Here you can see there is a reduced stance phase and increased swing phase of the affected limb, because to reduce the tension on the affected side, he will change his gait as soon as possible. Next we are going to see about the Tendel Gate. So Tendel Gate is caused by the weakness of the gluteus medius muscles. The function of the gluteus medius muscle is, when a person is standing on the one limb, so whole weight is beared on that particular limb. So the opposite pelvic will go for a drop. Okay, to prevent that and to stabilize the pelvis, the gluteus medius will work and it will stabilize the pelvic. If there is weakness on that particular gluteus medius muscle, the patient will lean on the affected side while walking. Okay, so what it happens, like there will be a contraction of the quadratus lumborum muscle to compensate the weakness of the gluteus medius muscle. So we will see the demonstration. So consider he has right side gluteus medius weakness. Okay, to compensate that, he will lean over that affected side, so that the quadratus lumborum contract and actively pull up the pelvis of the contralateral side. So next we are going to see about Parkinson Gate, which is otherwise called as fascinating gait. We all know what is Parkinson. Okay, due to reduced production of dopamine in the basal ganglia, it may lead to Parkinson disease. Okay, so what it happens, the patient will adopt a stooped posture due to rigidity. So there will be a forward flexion of the trunk, elbows, knees and plantar flexion of the foot. Okay, what it happens here is, the center of gravity will fall more anteriorly. So to chase that, the patient will adopt quick walking. So he will increase the speed of the walking. So we'll see the demonstration. See, here the stride length, step length is reduced, but walking speed and cadence is increased. Next we are going to see about the Wadling Gate. So Wadling Gate is caused by the bilateral weakness of the gluteus medius muscle. So to compensate this, the patient will lean on both the side while walking, so it may look like the duck walking gait. So we'll see the demonstration. Here, due to the bilateral gluteus medius muscle weakness, the patient will lean on stance phase side, that is either side. To compensate that weakness, he will contract the quadratus lumborum of the both the sides. So now we are going to see about the hand to knee gait or quadriceps avoidance gait. So during the stance phase, extension of knee is more important. So if there is weakness of the quadriceps muscle, to compensate that weakness, the patient will adopt trunk flexion and plantar flexion to actively extend the knee. If there is weakness of the trunk flexor muscle, he will use his hand to extend the knee. So the patient will actively uses his hands to extend the knee during the stance phase. So now we'll see the demonstration. So during the stance phase, here the patient will actively flexes his trunk and the ankle will go for the plantar flexion to extend his knee. So if there is trunk flexor weakness, the patient will use his hand to extend the knee. So now we are going to see about the hemiplegic gait or circumdictory gait. Okay, hemiplegic gait is usually seen in the hemiplegia or hemiparesis patients. Okay, so usually what it happens, like this patient may adopt flexor synergy of the upper limb and extensor synergy of the lower limb. So here the upper limb shoulder will go for the adduction, internal rotation, and elbow go for the flexion and pronation, and the wrist go for the flexion and fingers go for the flexion. When it comes to the lower limb, the hip go for the adduction, internal rotation, and knee goes for the extension, and the foot go for the plantar flexion and inversion. So during the swing phase, flexion of knee is important. Due to this extensor synergistic pattern, the patient unable to perform flexion of the knee. So to move the limb from the ground, he may adopt the circumdictory gait to clear the foot from the ground. So now we will see the demonstration. Here, during the swing phase, the knee should go for flexion to clear the ground, but due to the extensor synergy, the patient adopts circumdictory gait to clear the ground. Now we are going to see about the Ataxia Gate. So Ataxia Gate is otherwise called as drunkard's gait. So it is usually caused by lesion in the cerebellum. So we all know the function of cerebellum. It is to maintain the balance, posture, and the equilibrium. So if there is lesion in the cerebellum, the patient may have poor balance and postural instability both in eye open and eye close. It is one of the important features to differentiate between the sensory ataxia and the cerebellar ataxia. So to maintain the balance, the patient will adopt a wide base of support. So because of this, there will be an unsteady gait, exaggerated movements, and the walking speed will get increased. All the step length, stride length, and cadence will get decreased. See here, due to postural instability, the patient adopts wide base of gait and irregular movements are seen. Now we are going to see about the foot drop gait. It is usually caused by the paralysis of the dorsiflexor muscles, that is your tibialis anterior muscle. This is usually caused by if there is any lesion in the deep peroneal nerve. So what it happens, like during the initial phase, that is during the heel strike, dorsiflexors plays major role. But due to the paralysis of the dorsiflexor muscle, the patient will slap his foot on the ground to clear the ground. Okay. And finally what it happens, like they will slap the foot on the ground and lift the knee higher than the normal to clear the ground. So now we'll see the demonstration of the foot drop gait. Here, due to the paralysis of the dorsiflexor muscles, there is absence of heel strike. At the initial state, the patient will slap his foot to clear the ground. And also, he will lift his knee higher than the normal to clear the ground. So now we are going to see about the scissoring gait. Scissoring gait is usually seen in the cerebral palsy, that is spastic cerebral palsy, due to the increased muscle tone or spasticity of the hip adductor muscle. So what it happens, like the child will walk in scissor like pattern. The child will overlap his one knee on the another while walking. There are some secondary features seen in the scissoring gait. So there will be a hip internal rotation, knee flexion, and ankle plantar flexion along with this scissoring gait. So now we will see the demonstration. Due to the spasticity of the adductor group of muscle, the child will adopt this gait. Now we are going to discuss about the Gluteus Maximus Gait. Okay, the main function of the Gluteus Maximus muscle is the extension of the hip. So during the initial contact, that is during the heel strike, extension of a hip plays a major role. But due to this weakness, what happens, like the patient move his trunk posteriorly to compensate the weakness of the Gluteus Maximus muscle, so that it will help to actively extend his hip. So we'll see the demonstration of the Gluteus Maximus Gait. Here, during the heel strike, the patient moves his trunk posteriorly to maintain the hip in extension while doing heel strike. So this is otherwise called as posterior trunk bending gait.